Hi everybody, my name is Jake Perino and I decided to do a TED Talk on the difference between Hong Kong and the United States healthcare systems. So, when looking at healthcare systems between Hong Kong and the United States, we see that they are both a mix of public and private insurances. One of the differences between these two is that public insurance in the United States is seen as something of lower quality than private insurance, while in Hong Kong they are seen as being fairly similar. Private insurance can be acquired by Hong Kong citizens through their employers, just like in the United States, but many people choose to stay on the public plan since it's of high quality. Hong Kong public insurance is seen as being efficient and quick, while the United States is seen as inefficient and timely. And when we look at the rest of the parameters evaluating the quality of the healthcare systems between Hong Kong and the United States, we have to keep in mind that Hong Kong has a very small population relative to the United States. Hong Kong is about 7.4 million people, while the United States has 326 million citizens. So when we look at the population health, one of the main parameters we use is infant mortality rates. So if we look at Hong Kong, we can see that the IMR, or infant mortality rate, is about 2.7 deaths for every 1,000 live births. And so they rank number 10 in the world. Right here, third to the top, we can see that they're right between 2.4 and 2.7 deaths per 1,000 live births. And the United States ranks way down here at number 56 at 5.8 births per 1,000 live births, or 5.8 deaths per 1,000 live births. One of the reasons that this could be is that the United States has such a great gap between socioeconomic statuses. So there's a lot of poor people and a lot of rich people, and not a lot of people in the middle. Hong Kong, on the other hand, everybody is kind of wealthy there. And so there's a very small, poor population. Most people live well above the poverty line. Healthcare spending in Hong Kong and the United States. So total health expenditure in 2017 for Hong Kong was $150,000 million, which comes out to about $21,000 per capita in Hong Kong. In the United States, there is, for the 2017 year, there was a total health expenditure of $3.5 trillion. That is an astronomical number. And so that comes out to annual per capita spending of $10,700 per citizen on average. So in this parameter, even though per capita we see that Hong Kong has double the cost of the United States, we have to keep in mind that Hong Kong has a very small population compared to the United States and not such a wage gap. So these numbers can be disproportionate compared to how they really were. If it was $21,000 with a population of 300 million, then it'd be a different story. So from this figure here, the x-axis shows how much each country actually spends on healthcare, while the y-axis shows what the citizens of that country think they spend on healthcare. And so Hong Kong citizens think they spend around between 20 and 25% of the national budget on healthcare, when in reality they only spend 5%. So the government does a really good job of saving money there. While the United States spends about 17%, while people see it way up around 30%. And so we can see the United States as being a huge outlier here compared to Hong Kong right here among all these other countries. Healthcare systems, hospital-acquired infections. So Hong Kong sees between 2,000 and 2,700 hospital-acquired infections per 100,000 people treated in hospitals, whereas the United States sees between 5,000 and 10,000 HAIs per 100,000 people. So the United States has about at least twice as many hospital-acquired infections compared to Hong Kong. And so this could be say something about the quality of healthcare received in these settings and the sterile environments that they're in. Public and health perception, sexually transmitted disease prevention and control efforts in both these countries. So Hong Kong has a condom use rating among men of about 44%, while in the United States that's at 33.7%. And so when we look at people living with HIV, we see that Hong Kong hovers around 0.13% of the population, and the United States 0.18. Now, in some of my research, I saw that sex education in Asian countries, including Hong Kong, was kind of a taboo topic, and so it wasn't really talked a lot about. But in the United States, relatively speaking, it's much more talked about. Although many programs do advocate for abstinence, and that have shown to not be effective, which could be a potential reason that we see a higher rate of AIDS, HIV and AIDS in the United States. In Hong Kong, we see the air quality as being of around 105, and this is pretty high for the average air quality index. So standard, or it is not recommended for people to be living in places where the air quality is above 100. So that's not really what Hong Kong wants to see. This can be dangerous for unhealthy and sensitive groups such as people with COPD. And one of the reasons for this is because Hong Kong is a country state and has a very small and dense population, all living in a very small area producing a lot of emissions. When we look at the United States, it's hard to come up with an average of an air quality index because of the vastness of it and the many different environments. At its worst, such as in Kansas City, we can see an air quality index of around 167, which is astronomically high. Whereas in places such as state parks and rural areas, it can be as low as 10. So depending on where you live, that's a huge discrepancy. Access to care, primary care access. So Hong Kong sees primary care much differently from the United States. They take a much more holistic approach in treating the person before they get sick. There are about 14,000 primary care physicians, and so when considering the population of Hong Kong, this is a very good number. So that ranges about 180 primary care physicians per 100,000 people, whereas in the United States, there's about 210,000 primary care physicians, which seems like a lot higher. But when you look at the per 100,000 U.S. citizens, there's only about 156 to attend to them. So Hong Kong's doing much better in the primary care sector. But where Hong Kong lacks is in the number of healthcare specialists. So to see a specialist in Hong Kong, you can wait up to 3 years to see a cardiologist, whereas in the United States, it seems like if you want to see a cardiologist, you can see him the next day. So for this reason, the U.S. is much more specialist dependent, and there's a heavy need for primary care physicians in the United States. So Hong Kong, when looking at social and economic environmental measures, we look at the violent crime rate in this slide. Hong Kong had about 10,000 violent crimes in 2017, whereas the United States had 1.2 million in 2017. And one of the biggest differences between these two numbers is that most of the violent crimes that occurred in Hong Kong were robberies, whereas in the United States, they were mostly aggravated assaults. So robberies are included in the violent crime statistics, even if there's no violent actions taken during them. In 2011, in Hong Kong, there was only 17 murders, which came out to 0.2 murders per 100,000 citizens. And that's the lowest that the world has ever seen since they started this as a statistic. In the United States, however, the U.S. murder rate in 2017 was 5.29 per 100,000 citizens, so much higher than the Hong Kong 0.2 murders per 100,000. So in conclusion, the biggest difference between Hong Kong and the United States healthcare system is that Hong Kong follows a holistic approach to medicine, while the United States tends to follow the medical model of healthcare. So that means that Hong Kong, the healthcare system, aims to treat the patient before any symptoms come up or until disease affects the body. In the United States, healthcare often intervenes after disease has taken hold of the body. And so we can see this in the fact that Hong Kong has much more primary care physicians than specialists, and the United States has much more specialists than primary care physicians. In Hong Kong has a very small population, so this makes it easy to disperse the healthcare to the people that need it. Whereas in the United States, a huge population such as 327 million people and a large socioeconomic status gap makes it very hard to distribute healthcare. Both countries have a combination of public and private insurances, but the Hong Kong public insurance sector is much better and of higher quality. And because of this, Hong Kong is seen as having a universal healthcare system where most, if not all of its citizens have insurance, and in the United States it has been known to be a very big problem of being uninsured medically. So I hope that you guys all were able to take away something important between the two healthcare systems, and thank you for coming.